What if pain isn't a problem to fix, but a process to listen to? We live in an old story. In this story, pain means something is wrong. The body is a machine. When it breaks, we fix it. When it hurts, we numb it. When it lingers, we suppress it or replace it. Relief is the goal. Fast, efficient, reimbursable. This story has given us MRI machines, surgical centers, protocols, and paperwork, but it hasn't given us peace. And it definitely hasn't healed the chronic pain epidemic. In fact, it might have even fueled it. The old story, pain equals brokenness. Pain means tissue damage. Healing equals fixing or replacing the broken part. The clinician is the expert, the patient is the passive recipient. Emotions are distractions. If pain continues, it must be because the body failed or the patient did. This is the story of separation. It isolates the patient from their body, their experience, and their agency. But that story is incomplete. And there's another one emerging. In science, in clinics, in lived experience. The new story, pain equals process. In this story, pain is a signal, a messenger, a system doing its best to protect, not punish. Pain is a seed. It holds more than suffering. It holds possibility. Given care, time, and the right environment, it doesn't just go away. It transforms. Pain arises from meaning, memory, and context, not just injury. The body is intelligent. Sensation has purpose. The nervous system learns pain just as it learns language or fear. Healing happens through relationship, with the body, with others, with movement, with belief. Pain is not proof you're broken. It might be proof you're alive. The science caught up. Central sensitization explains how pain can persist without injury. Phantom limb pain shows pain doesn't live in tissue alone. The biopsychosocial model highlights the role of stress, emotion, memory, and social context. Movement, language, and narrative change pain, sometimes more than pills or procedures. The science has evolved. It's time our story did too. I once treated a man with persistent back pain who had tried everything. Nothing worked. When we stopped trying to fix his spine and started exploring his story, the job loss, the divorce, the fear of being seen as weak, something shifted. We moved, we breathed. He started walking farther, laughing again. He told me, "You didn't just treat my back, you helped me feel human again." That wasn't magic, that was meaning. Or the teenage athlete with chronic knee pain. Every scan came back clear, but she was overwhelmed, burned out, afraid to lose her identity. We dialed back the pressure. We changed how she moved, yes, but also how she related to movement. Her knee didn't need surgery. It needed space, permission, time. These aren't exceptions. They're signals, if we have the eyes to see. What this asks of us. Clinicians must be witnesses, not just fixers. Patients must be seen as participants, not problems. Systems must create space for time, trust, and trial. We must ask deeper questions, not just how do we stop the pain, but what is it asking of us? The promise of the new story. You are not broken. You are not alone. You are not a diagnosis code. You are in relationship with your body, your nervous system, your past, your environment. And healing is possible, not because someone fixed you, but because you remembered how to listen. This is a new story of pain, one rooted in science, shaped by listening, and carried by connection. This is the story I try to live and practice. Let's keep wondering together.